Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Sulphuric acid. Sulphuric acid causes burning pain in the mouth and throat. And this burning pain is a pharyngeal pain, which is the most common presenting symptom. The patient presents with epigastric pain in the whole abdomen. The patient has intense thirst, salivation, dysphagia, and dysphonia. The vomitus is around brownish to black or coffee brown, and it contains acid hematine or altered blood. Signs of sulfuric acid poisoning: entire lips, tongue, angles of the mouth, and oral mucosa are corroded. The pharyngeal mucosa is corroded and black in color except for the teeth, because the teeth become chalky white in color with sulfuric acid poisoning because of the corrosion of polish of enamel. Gastric perforation is most commonly seen in sulfuric acid poisoning. Fatal dose is around 5 to 10 ml of strong acid. Fatal period is for 12 to 24 hours. Treatment: do not do gastric lavage. Bicarbonates can be used orally. Do. You can dilute the acid with water, milk, aluminium hydroxide gel, demulcent like milk, starch, butter, and egg white. For skin, if there is sulfuric acid on skin, wash with lots of water and apply magnesium oxide paste or sodium bicarbonate paste. On in ice, irrigate the ice with normal saline sodium bicarbonate solution. Symptomatic treatment is done. Post-mortem autopsy appearances. Here the skin, tongue, lips, esophagus, and gastric mucosa become black in color. Teeth become chalky white in color. Stomach is converted to black spongy mass which disintegrates on touch, and thus it is called as stomach shows wet blotting paper consistency. It shows wet blotting paper consistency. Medical importance of vitriolage: throwing of corrosive with intention of causing disfigurement of face and head is vitriolage. It is dealt under the section 326A and B.
thank you and thank you for watching.